I can't believe it feels like we haven't seen each other.
We had a strategy review session.
I love these working dinners that we do, and particularly we do them on the road when I'm out traveling and in a different country. And I love them because it's a chance to gather local experts in their own fields. Because you have that more relaxed time over dinner, it's I find a more real conversation.
It allows for free flow of ideas, and that exchange is important because then you can also use that virtual format to hear from communities from wherever they are without having to travel there. And I think it's a really effective format, advising the foundation on its policies and future strategies.
It removes the pressures of too many audiences and feeling like you're on a stage. It's like a conversation, and that's how change happens.
We're having some chicken. Ours is indigenous chicken. We call it the road runner. And we have some vegetables as well, and some potatoes. And on your end, we ordered from one of my favorite Seattle restaurants.
Yes, we are very much looking forward to digging in.
Can we do one thing before we start? So we have a family tradition that I grew up with, which is everyone before a meal goes around and says one thing that they're thankful for.
What I'm really grateful for is time with family that the pandemic has allowed, which is paradoxical because normally you would think that you can spend time with family, but because of the lack of travel, there's just been much more time to actually get to spend with each other.
And I'm thankful that my two parents, who are 81 and 83, have come through the pandemic in a healthy way.
I think I'd have to say I'm thankful also that we're finally coming out of this and that the future looks much better than it did 2 years ago.
I'm thankful for the chance to have connected more with family, especially my grandma, and also to deepen friendships that for a long time I hadn't had time to invest in.
Wow, I'm grateful, like Melinda, that my mother is alive. My mother is 86. I am really grateful. She's still alive, she's well. That's what I'm grateful for.
Wonderful, wonderful. So there is a common theme here about parents and family.
For sure.
Yeah. Let's start with thinking back to March of 2020, where we faced so many closures. And all of a sudden, we found out that the foundation was going to be closed. Then we found out colleges and schools are going to be closed. Airports are going to be closed. Offices are going to be closed all around the world. My son was at college, and college closed down. And that was a very terrifying, frantic time for me worrying about him.
Yeah, so I have a daughter in high school during that time. So all of a sudden, she's home. We had a son in college, and I was like, how quickly can we get him home? Is it safe to come through the airport? Who are you going to be around? And so all of a sudden, I had these two young adults back in our home. All the kids were out of school all over the world.
The pandemic has affected different people differently. Although everybody has been affected all over the world, what we have realized is that some inequities that existed even before have become worsened because of the pandemic, and some completely new inequities surfaced during the pandemic.
It was actually a very anxious moment. Very early on, I remember in March when the lockdown started, we had a staff meeting, and I asked the staff, what do you prefer? We are not sure that we are going to sustain our financial commitments at the end of the year. So we have two options, to let go some people or to keep everyone and to let go part of our salary. And the staff decided to take a pay cut of between 7 and 25%. And that was a very difficult moment because we are talking to people from different countries, people in Malawi, in South Sudan, in Ethiopia, in Senegal. Everybody had an impact from this pandemic. People lost loved ones, people lost incomes, people lost jobs. This was disproportionate for different people.
Women who sell by the roadside, women who work in informal jobs directly, they lost their jobs much more faster than folks who were able to restructure and work from home.
So you can't go sell your goods at market if the market's closed. You can't go up to the road and have your vegetable stall if there are no cars going by. I mean, your business is shut down.
Catherine, with all of the closures that happened around the world, that was very affecting for my family. How did it affect your family?
At a personal level, my mother lost her business, and to date, she's not recovered from that. So my mother would run a social enterprise that provides informal education to children from ages from 5 to 14 years as a way for creating pathways for them to integrate into formal education. So overnight, I became the primary breadwinner for my family, my mother and my 3 sisters and their siblings. So I can only imagine other families who didn't have as much cushion as mine did.
I'm really sorry to hear that the pandemic has affected everyone, but it's affected people differently depending on who you are and where you live. We know that, for example, men, especially older men, have suffered the most disease and deaths, but even that has varied depending on who you are and where you are. But there's all these shadow epidemics, shadow pandemics that have happened as a result of the COVID pandemic, which have impacted people differently.
So, Catherine, one of the things that we started to see very early on was we knew with women home, likely there was going to be more gender-based violence, and we started to hear about it from some of the high-income countries. What was your experience with that, and what should the world know about gender-based violence during this time?
One of the things that was staggering for everybody was when gender-based violence was declared a shadow pandemic. Women's rights activists knew this would happen. There was alarms that were being signaled at the beginning of the pandemic that there's need for us to look at this response beyond a medicalization-only response. And a few months into a month, I remember South Africa reported 100-fold of increase on gender-based violence. And that's where we had data. In many instances, we did not have data. Shelters were being overwhelmed in terms of number of survivors reporting for support, increased cases of teenage pregnancies across the country, female genital mutilation, child early forced marriages. There was such an upscale of numbers almost overnight. And some of these were driven by women had lost their economic livelihoods in the most part, so they were reliant on their male counterparts. And they were also locked down in what would be abusive settings.
That has been so sad.
Unbelievably sad.
If women are not there at the decision-making table, making sure that all of the policies are not going to affect women adversely, a lot of unintended consequences can happen. One of the things that I've been very upset about has been when the lockdowns happened. People didn't think how would women who were pregnant and in labor seek care when they had to deliver their baby. And many women could not deliver in hospitals because of the lockdowns.
It's made, I feel like, the work that the foundation does in some ways even more important. And if we're going to get women back on their feet, because they are the center of the family, you've got to think about the economic piece. How do you help them get back their informal job? How do you help them have childcare? Those are issues we had not addressed before as a foundation. And yet the women's piece of this is so important. And so I think as a foundation, it's made us all the more committed to driving some of those pieces with the global partners.
Over the course of this pandemic, the hardest has been for individuals who are on their own and individuals who have small kids at home. And they have borne the brunt of having to combine home and work with COVID.
You know, I think for women, what we've seen is this care crisis. We now look as a foundation more at what we call care, cash, and data to try and help women get back on their feet. But the care crisis, if you don't have someone who can care for your child or care for your elderly parent or get the medicines for your elderly parent, it's a crisis.
So the other thing that that developed, unfortunately, is the vaccine inequities. And so when we think about the next pandemic, having enough capacity so that you can have enough doses for everyone in the world is going to be really important.
I remember the global leaders coming together with the goal of trying to have vaccine equity, and just so disappointing later to see it not play out.
Well, I would be lying to say I was surprised. I wasn't surprised. Africa has suffered this for a very long time, and I'm sure the same in other low-income countries. And it is because even when we come to global responsibility, it's been treated in many ways as tokenism. We saw this happening with HIV era, where there was no drugs for a very long time until people had to go on the street, people had to strike to get that done. So I wasn't surprised, but I was disappointed. I was thoroughly disappointed because we had actually put structures in place. And that, we just call that greed. There's no other way to define it. It is actually greed that resulted in the disparities, loss of life. I lost a very close friend myself who is a wife to a close friend of mine, who died because, she got infected too early for the vaccines. We knew that if the vaccines were available, it should have been one of the first people in the country to receive them. The vaccines only got into Africa probably 4 months after they were accessible in high-income countries. Those 4 months cost us lives. And that is what we must reflect on, that these inequities are about individuals, they're about lives. It has been, it was, it still is, it still continues to be an unacceptable situation of equity on a commodity that is supposed to save lives. And the world must think about the fact that since we cannot rely on goodwill, what structures do we need to put in the future to protect this personal greed and this selfishness? I don't think we can leave it to individual goodwill anymore.
I mean, we need a more distributed network of vaccine production for supply security in the future, and to be able to have enough vaccine produced that you can get it to the whole world and you don't have this inequity develop early on. And within months of a pandemic being declared, everybody can be vaccinated. That's like a big lesson.
There was a fascinating paper from one of the top hospitals in Boston, the Massachusetts General Hospital, where they really were delighted to show that there was no transmission occurring in the hospital. And that is because the PPE was available for everybody, and all the people who were getting infected were getting infected in the community. Now, that was not the case in Africa at all. The burden on the healthcare workers was enormous, and there was no way to protect them from this virus in any of its stages.
Everybody should have access equally, at the right time, at the same time, to this life-saving commodity. But we found that actually some lives mattered more than others, that lives in high-income countries were more protected than lives in low-income countries. There was also the risk that health workers who are working in low-income countries could actually not provide optimal care to people because they were afraid of getting infected while they were not protected with the vaccine. Most importantly, it also meant that the virus could continue circulating longer in low-income countries and populations, and therefore present the danger of new variants arising that were then going to put the entire world at risk. This is why equity and access to vaccines at the same time for everyone in an equal manner is important for global health security.
Githinji and Catherine, what would you say you wished we had done earlier as a foundation? What could we have helped with more that would have made things better in places that you work in Africa?
Some of the things that were salvaged, so to speak, at the beginning of the pandemic was because of people who were able to respond swiftly, in terms of safeguarding jobs and in terms of providing any kind of solidarity support that everybody who needed to convert their programs overnight to provide any safety nets for response. So any person who was running a youth center that could be converted into a gender-based violence shelter. And that means having the support of investors and funders like the Gates Foundation. And number two is investing in those organizations that were frontline response in ways that are sustainable, that you provide flexible funding. It really allows for them to build those systems, and that resilience is enabled with a much more stronger fabric.
We saw that health facilities that did not have autonomy on how to use their money could not even buy PPE, and yet PPEs were stuck in the supply chain, but they needed to call the local governor or the minister for them to get. But if they had autonomy, they would buy the PPEs they needed. We have in-country inequity and we have within-country inequities. Even where now we have vaccines in Africa, in many countries, you find that the urban areas have 50% vaccination rates and the rural areas have 4% vaccination rates. So it's a huge gradient of access that needs to be closed. And this doesn't have to be closed through just financing the healthcare system. The foundation and others like the foundation need to give up their power. The closer to the community the power rests, the better, because then the communities can respond to their needs real time. Traditional development aid mechanisms do not respond to emergency. So the question is, how do we build future, more resilient systems, communities and systems, by giving over our power of decision making and making sure that that rests much closer to the society than it currently does.
This is what I've missed so much. This is why these dinners are so important. And the feedback you just gave us, really important. And there'll be things we thread back into the foundation because we all need to be learning.
And that's a really important point you made, empowering community organizations, and that's something we can do. We obviously can't fund government responses, but empowering community organizations to change policy, to use the levers that they can, that's stuff we can do.
So thank you so much for the wonderful meal that you chose for us, Catherine. We are having some really nice dessert bread over here. Thank you again, and thank you, Melinda, for joining us. Thank you, Keith. It's been great. Thank you.
Thanks for the time.
Thank you so much. And the dinner was absolutely amazing. So
Yeah,
thank you
you
for
did
the
a great
conversation.
job, Catherine.
Yes.